Hey, good morning, you guys. We are going to be talking about some things you might want to talk to your doctor about if you are a Black woman and your doctor is not versed in Black people, which happens quite a bit because if you guys didn't know, in medical school, doctors are not trained to look for ethnic differentiations at all, unless they do so for themselves, unless they research it themselves. Most of the protocols that are given in hospitals, though they tend to work well most of the time, are not specified for certain races and ethnicities. And surprise, surprise, people are starting to figure out that different ethnicities have different needs. And I've said this for years, simply from just having my own, taking the liberty to look up things myself, that different bodies, different ethnicities require different things. Different ethnicities have different microbiomes, they have different immune systems, and different doesn't mean bad, it just means different. So some people, why do people who have no melanin wrinkle so easily? Well, they don't have melanin in their skin. Their skin is not protected from the sun like ours is. Different. So they have different needs than we have when it comes to the sun, when it comes to vitamin D, right? So their skin is going to be more sensitive than ours. You can't just blanket assign traits, right, to people because everybody is different. So we're going to talk a little bit about that today, because I think this is something that we kind of shy away from, especially with the health industry, because to be honest, there's so much arrogance on behalf of doctors and nurses. They literally think they know everything. And it wasn't until my sister, who is in, one of them was in, two of them are in medical school, but she sent us this chart that was in one of her textbooks, and it was basically racial profiling based on the ethnicities of the patients. And she's like, I can't believe they still teach this. And I was like, yeah, I could see that because of how, people who are not Black respond to Black patients. I'm like, well, duh, yes, they do. So where I was going with that is, this is not something that is readily taught in school, so you have to advocate for yourself. As a Black woman, you always have to advocate for yourself regardless, but when it comes to your health and being in the doctor's office, you should definitely work to advocate for yourself. So I'm going to share with you guys a couple of stories that I had, because I have been super blessed to have doctors who are semi-crunchy, meaning they don't fall wholesale into the medical industry complex, pharmaceutical. They don't fall headfirst into that. That's like their last resort, even though they do work as MDs, because they're like, okay, if something's wrong with your body, you don't put something on top of it. You figure out why your body's not doing what it's supposed to do. So in my case, my doctor, oh my gosh, I think I was 27, and my blood work was so bad. It was so bad. She was like, she's like, you look like you have, she was like, I'm gonna have to test you for, was it leukemia or something? She's like, I know you don't have it, but your blood looks so bad. I was missing massive amounts of blood volume because I was just not living the most healthy lifestyle, meaning I was stressing myself out, right? My cholesterol was super low, which in some cases people are like, that's so great. My hormones were all over the place. And one of the first things she told me which made me realize that everybody is different, is she goes, they've actually realized that so when you get blood work done, there's a range, right? So it'll be lower range and then high. And then there's a range in the middle. So number one, there's something called the functional range. So let's say the optimal range for blood sugar is 70, even though the low end would be 40 or the high end would be 120. As long as you're in that range in a medical system, you're fine. But with a functional doctor, it's okay, what's the best range for you, right? So with cholesterol, I couldn't tell you what my numbers were. I'll have to go back and look at my Sutter Health app, what my numbers were. But she goes, I was concerned. Number one, she was like, you got to eat more, right? And because my cholesterol was way like so low. And so it started to creep up. And then she goes, for Black women, they can actually have a little bit higher cholesterol, and it means that their hormones will actually function better. Now, she's not saying go all the way over in the above average range. She said there's a range that is higher for Black women than it is for white women or Asian women or whatever. She was Asian. And so she said, don't be so concerned about it going too much in this direction, because your hormones will actually function better with higher cholesterol, because you need that to function. If you have too low cholesterol, then things start shutting down. And I was like, why did nobody tell me this? Like, why is this not common knowledge? Because doctors, nurses, they're not trained in differentiating factors for race and ethnicity. Surprise, surprise. So that was the first instance of me realizing that, okay, I need to either find a doctor who is just as dedicated to providing me full spectrum healthcare, or I need to just research this myself. So I still will text my brother or my sister and ask them to look up things in PubMed for me, or look up things in whatever databases they have to cross-reference like what my thoughts are and what my ideology is, because there's things in there that you never see in medical school. Like they'll never publish that and make that wholesale information. Number one, because it's just too much, right? And we're only 13% of the population. Like, it's not like the majority of the population is white American. So they're not going to be, they're not going to be trying to tailor their education to a 13% population, which is why you need to advocate for yourself. So to this day, I'll still text my sister or text my brother and say, hey, like what medical documents do you guys have on this? Like, what do you guys think about this? Is there anything specifically related to Black women in this? All the time. Which, if you have someone in your family who can do that, make that a regular part of your routine. Make that a regular part of your day, because whenever you have an issue, because I'm telling you right now, the doctors do not know or do not care. The second thing that I learned, but I learned this like quite a while ago, was my vitamin D was super low as well. And she was like, she goes, where do you put your sunscreen? And at the time, I didn't wear sunscreen. Like, I was coaching track and I was teaching PE, and I was outside like 12 hours a day. And she was like, where do you put your sunscreen? And I said, no. I said, I don't put it anywhere. And she goes, okay. So she goes, that Black people, or people with high concentrations of melanin, in order to absorb the same amount of vitamin D from the sun, they have to stay outside longer, because your skin obviously serves two purposes, right? It protects you from the sun. It does absorb vitamin D, but she said, you're gonna have to spend more time. I told her, okay, I spend like 12 hours a day in the sun. And she goes, okay, there's a problem. So then we figured out my vitamin D stuff. And my vitamin D deficiency. But I just learned that, we are not going to get the same vitamin D as a white person when we sit out in the sun. Now, the offset of that is Black doesn't crack, right? Like we don't get wrinkles very easily. But now she goes, okay, so let's have you supplement with vitamin D. And so, while some doctors will be like, oh, take 200 IU, she's like, no, you need like 5,000 to 10,000. I was like, what? She's like, yeah, you're like deficient. You're not just behind, you're highly deficient. So I learned that from her, and I was like, wow, that is so important. And the other thing that, there was an aside from this is, so you guys know seasonal depression is a real thing. Well, Black people can experience heightened symptoms of seasonal depression, because if the sun is not out and the UV rays are not, and we're not outside as much, we then have less vitamin D than we would even in the summer. Right? So you really need to supplement vitamin D in the winter. If you're living in a place, well, I live in California, so sometimes the sun is out, but if you're in like a Washington state, or if you're in like, a Kentucky or a New York where it gets really, really, really cold and the sun is not out, that can be something that is problematic for you. So all of that to say, you guys, that you really need to be advocating for yourself in the doctor's office and even in the hospital, right? You need to be advocating for yourself and asking questions, and then go home and do your own research. One of my favorite things about this doctor that I had was that she would say, okay, I don't really know what's going on here, but let me go do some stuff. You go do your research, I'll do mine, and when we meet next, we'll figure this out, because I still had the issue with my blood where I just wasn't getting enough red blood cells to my body. Like, I was super low blood count. And so it took us a while to kind of work that out. And I was like, well, I think it's this. And she'd say, well, if it was that, then I'd see this marker. And I'd be like, okay, well, what about this? And she goes, yeah, possibly, let's, and so she had me like eating red meat. That was another thing. She's like, I was like, iron pills are not doing it for me. And she goes, then eat red meat. Because your body it's more bioavailable than regular meat. So there's all this stuff about red meat and you shouldn't eat it. But for my particular body, when I eat red meat, I'm actually most energetic. I get the most amount of iron. My blood markers are much better when I eat red meat. Now, y'all know that I eat grass-fed and organic red meat. And that those red meat studies are typically done with people who eat like chicken fried steak. Chef Boyardee is considered red meat. Of course, McDonald's is considered red meat. So they're not really, when they do the studies on people who eat red meat in a healthy diet, the results are not the same. So all this stuff about red meat causing colon cancer, well, we have to also look at, okay, if you're eating red meat, what kind of lifestyle do you have? But the truth is that people who tend to eat red meat in the form that they are studying, aka McDonald's, Chef Boyardee, I don't know, y'all tell me some other fast food restaurant, those people tend to be sedentary. So of course things are going to get stuck in your colon. Of course things are going to you're going to have toxins that are built up because you are sedentary. Those people tend to also not eat a lot of vegetables. We know that vegetables help your body and your liver to detox. So even if there is something to this red meat issue, right? Cholesterol, all that other stuff, people who tend to eat meals that are cleaner, meaning they are not fast food, they're not highly processed, they don't have these same issues. So again, a doctor has to know this. They have to be willing to research this. And to be honest, most of them are not. They're just not. So you have to be able to ideally have a practitioner who is humble enough, because that's really the issue here, is like they're just not humble. Like, you have to have a practitioner who's humble enough to say, I'm actually practicing. Like, I was like her little test case. Like, she loved it. We were like, and then she was also into like nutrition and like woo-woo stuff, like, go get some energy work done, go get some acupuncture. Like, she was all about it. And which is very rare, because they're trained that all that stuff it doesn't work and all this other stuff. There's another story that I'll have to tell you guys maybe in a year or so about another instance where doctors are just strong and wrong, and I'm like, that's actually not what the research says. But anyway, so please make sure that you are asking questions about how different lab results indicate different things in Black people. And if you're a woman, then Black women specifically, right? They're still trying to figure out preeclampsia. I think not preeclampsia, gestational diabetes. I have a theory, because none of the clients that I have worked with have had gestational diabetes while being pregnant. And so I'm debating whether I'm not a doctor, right? So people get told, you're not a doctor, you don't know. But I have a theory on why my clients have not gotten gestational diabetes. And I've worked with several pregnant women. But I have a theory based on some research that I read about women who are pregnant. So, like, you got to do your own research, guys. You really need to ask questions. You don't have to be right, but you do have to ask. You do have to be curious. And ideally, you have a practitioner who is curious, and have a practitioner who is willing to listen, because that's the key. A lot of them, again, I'm a nurse, I'm a doctor, I know everything, I don't need to, that's not good for you. Girl, you don't know what's good for me because you're not Black. You know what I mean? Like, you're just not. And I know that sounds crazy, but there are literal differences in your body. There are literal differences in our bodies that cannot be accounted for any other reason other than ethnicity. So it's really hard to empower yourself to have this kind of stance. And I understand that. And I think that's why so many Black women struggle with their health too, is that a lot of these doctors are giving them blanket prescriptions that don't necessarily fit what's going on in their lives, and they're not curious about it. I mean, I remember my doctor telling me that I need to break up with someone. She was like, nah, she's so funny. She was like, he's causing you stress. She's like, no, she goes, that's part of it. Cause she believed in psychosomatic symptoms. She believed in, if you have these stressors in your life, they're also causing all these problems. Like, imagine your doctor caring enough about you to tell you that you should question whether or not you're dating the right person. Like, that was the kind of person that she was. And I think that's the kind of person that everyone deserves to have. And it may take you a while to find that, but that's the kind of practitioner that you deserve to be in contact with. Someone who genuinely believes in holistic health and medicine. All right, you guys, I'm gonna go batch film some more, and then if you guys enjoyed this video, if you guys want to talk more about my experience, you guys have questions, leave a comment below. Again, this is not medical advice. These are things that my doctor shared with me that shook me to the core, and I was so shocked about. But they have absolutely changed the way that I interact with doctors and interact with medicine altogether. All right, you guys, have a wonderful day. Don't forget to like, share, comment, and subscribe. You are welcome to disagree. You just can't disagree disrespectfully, or I'll delete your comment. Dissent is welcome. Disrespectful dissent is not. Have a beautiful, wonderful day.